We all good? Good to go. All right. Morning, everyone. I am Barato Britt. I'm a very proud president and CEO of the Edna Martin Christian Center and a proud member of the directors of United Neighborhood Centers of Indianapolis. It's my pleasure to welcome you to the Edna Martin Christian Center at 37th Place, a facility that's affectionately known as the heartbeat of Martindale Brightwood. I'd also like to welcome those able to join us online via our live stream. Today, we're happy to welcome our community leaders from United Way of Central Indiana, Southeast Community Services, Martin University, to make an announcement that we know will make an immediate, profound effect on so many Hoosier lives. We'd also like to announce speaking today in this order our friends, Mr. Fred Payne, the President and CEO of United Way of Central Indiana, Peggy Frame, the Executive Director of Southeast Community Services and the spokesperson for United Neighborhood Centers of Indianapolis, Dr. Sean Huddleston, a good friend and President of Martin University, and Sam Snideman, VP of Government Relations for United Way. And they are speaking in that order. So at this time, it is my great pleasure and privilege to welcome Mr. Fred Payne.
Good morning. I'm pleased to be joined today by this distinguished slate of civic leaders in our community. We've gathered you all here today for an announcement that will positively affect tens of thousands of Hoosiers in Central Indiana. Those Hoosiers who are burdened by significant and compounding medical debt, which prevents them from living the lives they're capable of living. And the announcement is this: as of today, over 100,000 residents in our 7-county region have received or will be receiving a letter from Undue Medical Debt, which is a national not-for-profit whose purpose is to partner with philanthropy to erase financially burdensome medical debt from households and communities that need it the most. The letter in my hand right now, it reads in part, "You no longer owe your medical debt listed in this letter. The funds for this act of debt abolishment were generously donated by the United Neighborhood Centers of Indianapolis and the United Way of Central Indiana. Today, we're proud to partner with and acknowledge the United Neighborhood Centers of Indianapolis to make a combined investment of $1.7 million to relieve more than $239.6 million in medical debt to 112,018 people in our region who are below 400% of the poverty level or who are facing a medical debt of more than 5% of their income. These households are all located in United Way service area. That service area includes Boone, Hamilton, Hancock, Hendricks, Morgan, Marion, and Putnam counties. Our United Way investment of $500,000 comes directly from a transformational gift made to us back in 2021 by philanthropist Mackenzie Scott. Our goal all along has been to use these funds to do 3 things. 1, generate widespread benefit to our community that would not be possible without an initial investment. 2, support collaborations to improve or expand initiatives that serve households living in or are one emergency away from poverty. 3, to implement initiatives that tackle the leading indicators of poverty, a foundational element of United Way's 5-year strategic plan. Now, with that said, today's announcement is not just about crisis intervention. At United Way, we're fighting for the long-term health and economic well-being of every person in our community. This is an important initiative aimed at raising awareness of the complexity of medical debt and how it prevents families from achieving financial security. This is an important moment to lift up our community organizations and to provide free, convenient, and low-cost health care and financial services to anyone who needs it. And this is our time to stand in partnership with our direct service providers and advocate for better public policy at the local and state levels. Dr. Huddleston and Sam Snideman will offer some additional details on these issues at the end of today's presentation. Now, on behalf of our board, our United Way of Central Indiana team members, and community partners here today, I cannot thank the United Neighborhood Centers of Indianapolis enough for this significant co-investment of providing much needed relief to thousands of households in our community. We're also thankful for the opportunity to deepen awareness and advocacy on this special and important issue at all levels for a more equitable and affordable healthcare system for everyone. Now, at this time, I'd like to now invite Peggy Frame from Southeast Community Service to the podium for a few words. Peggy.
Would all the community center directors or representatives please come on up at this point in time? It's nice to have a group up here with me. Right. Good morning, everyone. Thank you for joining us today for this very special announcement. Alongside me are the CEOs and executive directors of 12 other community and neighborhood centers that provide essential services throughout Marion County to our low-income neighbors and their local communities. Together, we form the United Neighborhood Centers of Indianapolis, a collective that's been instrumental in major initiatives such as Indy Rent and Marion County Energy Assistance Programs, and today's announcement regarding medical debt relief for our neighbors. I'm speaking today as a representative of UNCI and to make this announcement. Joining us today in today's announcement are the following community centers: Christamore House, Community Alliance of the Far East Side, or CAFE, Concord Neighborhood Center, Edna Martin Christian Center, Faye Bacard Click Neighborhood Center, Flanner House, Hawthorne Community Center, John Bonner Neighborhood Centers, La Plaza, Martin Luther King Multi-Service Center, Mary Rigg Neighborhood Center, Shepherd Community Center, and Southeast Community Services. On behalf of all of the community centers, I want to extend our heartfelt gratitude to the anonymous donor who stepped forward and donated over $1.2 million to our effort. For many years, they have worked with many of our centers, diligently supporting initiatives to bust through barriers in people's lives, albeit housing, education, transportation, or in today's case, alleviating medical debt. I also want to express my sincere appreciation to United Way of Central Indiana and Fred Payne, along with his board of directors and executive team, for joining us in this effort. United Way's substantial co-investment in medical debt relief, coupled with their policy and advocacy team's expertise, has been invaluable in shaping the recommendations that we believe will significantly strengthen charity care policies and limit damage to patients' financial well-being. The idea of collaborating on medical debt relief was an effort first proposed as part of the East Side Economic Mobility District. I'd like to also thank Elizabeth Nash, its director, for her help on this effort. Established in 2019, Bonner Center, Edna Martin, and Southeast, along with other CDCs and neighborhood groups, created the district to implement innovative tools to assist in building wealth for neighborhood residents through asset building, entrepreneurship, economic development, social enterprises, and housing innovations. Medical debt abolishment was one of our asset building strategies. What was originally an effort focused on Marion County and only 3 neighborhoods grew to include all of Marion County because of the generosity of our donor, and with United Way's subsequent involvement, expanded to include the surrounding counties. Now, in the next few weeks, 112,018 beneficiaries, of which over 90% live within Marion County, will be receiving a second letter from Undue Medical Debt. This second letter will reaffirm the abolishment and provide them with information on the community centers where they can find opportunities to create prosperity and well-being, whether it's a better job, workforce development, workforce training, financial coaching, childcare, or other resources. In addition, contained in this letter will be a list of federally qualified healthcare centers within Marion County where they can seek services regardless of insurance status or previously owed medical debt. The statistics surrounding medical debt are staggering. Medical debt contributes to 66.5% of all bankruptcies filed in the United States, and on credit reports, it makes up 58% of all debt listed, totaling $88 billion. In Marion County, 1 in 5 residents have medical debt in collections, and in Indiana as a whole, ranks 11th highest in the nation for the share of its population with medical debt and collections. For countless neighbors, a visit to the doctor or hospital stay can result in debt that can haunt them for years, exacerbating financial turmoil and perpetuating cycles of poverty. Furthermore, medical debt doesn't just impact individuals. It reverberates throughout entire communities, hindering economic growth and perpetuating a cycle of financial strain. It is time for us to acknowledge that healthcare is a fundamental human right, not a privilege reserved for the wealthy. We must strive for a system that ensures affordable access to quality care without the fear of financial ruin. This extraordinary act of kindness will offer much needed relief to countless individuals and families, allowing them to focus on their well-being and financial stability without the looming specter of medical debt. To discuss what we and our major healthcare systems can and should do locally to make a more just and equitable system, I'm delighted to introduce to you Dr. Sean Huddleston, President of Martin University. Thank you.
What a great day, isn't it? This is a great day. I have the honor of reading a statement from an anonymous donor who made a transformational gift to make today possible. The statement reads as follows. We're pleased to have worked with the United Neighborhood Centers of Indianapolis, Undo Medical Debt, myself, Dr. Sean Huddleston of Martin University, and the United Way of Central Indiana to provide this assistance to over 112,000 families in our region with this gift. Yet, the bigger story is the massive problem medical debt creates in our country, state, and neighborhoods. We would encourage our state legislators and the medical delivery entities to make policy changes in 4 areas. The first area is to strengthen charity care policies. Recommendations in this area include increasing the income threshold to qualify for charity care under Indiana law. The current eligibility requirement is 75% of the federal poverty line, and it lags far behind national and regional norms. And it also means that any family or household with 4 members and an annual income of more than $22,500 is not eligible for charity care. Now, national and regional norms are in the 200 to 400% range of the federal poverty line. The second recommendation in this area is to establish policies that mandate all patients are screened pre-billing to determine eligibility for charity care, discounts, or other financial assistance. A third recommendation in this area is continuing to notify patients of discount options at each payment point in case a family's income has changed since the last transaction. The second area of focus is to limit damage to credit scores. Recommendations in this area include preventing medical debt from being reported against patients' credit score. Now, this could be done outright, which is the most consumer-friendly method, or it could be up to a certain dollar amount. The second recommendation is to prevent wage garnishment as a tool to collect unpaid medical debt. The third area of focus is addressing billing and collection practices, and recommendations here include requiring all debt collectors to inform patients if the debt they are attempting to collect has passed the statutory repayment terms. And the fourth area of focus is controlling the cost of care. Recommendations in this area include requiring providers to delay all medical debt being referred to collections while the billing is being appealed. The second recommendation is to encourage hospitals to enroll currently uninsured patients in Affordable Care Act plans, Medicaid, or other available resources to ensure the cost of future care would be covered. And the third and final recommendation is to establish pricing transparency and standardization. These issues must be addressed by our legislature and the medical delivery systems within our state. The need is urgent. That is the end of the donor statement. Now, I, like everyone here, am deeply moved by the generosity of the donor. However, I'm also encouraged by the intentionality around the changes they request, and if successful, would significantly reduce or possibly eliminate the need for such a bold action in the future. I must also share, because this was important to me, that I reached out and have personally spoken with the leaders of some of our healthcare systems, and I am pleased to report Many changes have already been made or are underway. For example, most systems have already made policy changes regarding the minimum income thresholds to qualify for charity care, so that each of the four healthcare systems, their policies are now within the requested range of 200 to 400% of the federal poverty level. Also, some of the systems have already abolished wage garnishment for medical debt. And regarding price transparency, each of the four systems has a link on its website and last page, and a phone number to call to get price estimate to help prevent surprise billing, and that is a result of recent legislation. So I truly do applaud the work that's being done by healthcare systems and policymakers to address these significant concerns, but I look forward to their continued efforts so that they align with the recommendations that were previously shared by the anonymous donor. Thank you.
Not quite as tall as Dr. Huddleston. So I just want to start by noting that this generous gift by our anonymous donor, coupled with efforts by policymakers and advocates, and certainly by the work of direct service providers like Peggy and others who are here today, helps all of us achieve our broader goals of distancing individuals and households from poverty. As the impact of this gift shows, hundreds of thousands of people and their families will benefit from debt relief now, and our communities will be better for it. But while a one-time investment will have a ripple effect for families and community, it doesn't address the root causes of medical debt or financial hardship. This makes it a priority for our organization to pair this investment with steps toward a sustainable system for the future. Making a lasting impact will require government, philanthropic, and corporate partners to work together. Providers and insurers play an important role as responsible corporate partners and key pillars in addressing the cost and debt challenges in healthcare. And many providers, as Dr. Huddleston mentioned, are, even as we speak, working internally to address their own practices and policies to be more consumer friendly. As we heard from Fred and Peggy this morning, the magnitude of the medical debt crisis for individuals and communities is enormous. And like many of the healthcare challenges vexing our country, it requires the engagement and action from all levels of government. There is an urgent need for patients, providers, insurers, policymakers, and other community partners to work in the same direction toward a healthcare system that prioritizes quality, accessible care, and good patient outcomes. The policy proposals mentioned by Dr. Huddleston in the donor statement represent some initial steps that we can take now in partnership across the system to ensure that individuals and families who are receiving this debt forgiveness and this transformational gift today don't find themselves in similar circumstances in the future, and to ensure that the healthcare system works for people regardless of income. And I do want to acknowledge, I think it's important to acknowledge the recent announcement last week of a proposed federal rule that would prohibit medical debt from impacting credit reports, which is a policy recommendation mentioned by our donor as well. If this moves forward, the rule may help families do things like rent an apartment or qualify for a car loan, reducing the impact of debt on other aspects of their lives and having a positive impact for families who have been affected by a health crisis or just plain bad luck. However, the rule itself will not relieve medical debt. So families still need a path to ensuring that they can afford their future healthcare needs. We will continue to advocate for pairing together policies on all levels of government, even as steps forward are taken. We know that there is work to be done across government to build on the important work that our General Assembly has already begun. I want to extend an invitation to all interested parties who want to work on advancing community-focused solutions to addressing the ongoing challenges in healthcare and delivery to join with us in this work. Thank you for being here today for this announcement, and we'd like to open the floor for any questions from members of the media. or from the live stream. I know Margaret's also keeping an eye on the live stream. Okay. Go ahead. Oh, yeah, sure. So we're not sort of in a position where we're sort of like choosing individual people, right? So the way that undue medical debt, which was formerly known as RIP medical debt, works is that they connect with providers, with health systems, or with collections groups to sort of purchase debt in bulk, right? So it's sort of it is more or less a blind process to us, and it is geographic in nature. And I think Fred's got some more here. Yeah.
So there's an algorithm that undue medical debt uses that includes the federal poverty level up to 400% and or 5% of the person's income. So there's an algorithm that shows the people who are in those affected areas who are within that range. And part of it is to make sure that the people are in debt collections. So we want to make sure that we stop that. And one of the reasons why it's so important that we did something like this is to add some closure to individuals so that 2 years down the line, someone doesn't pull a debt off the shelf and then they come after them for that. So there's an algorithm that identifies the individuals based upon those parameters, up to 400% of the federal poverty level or 5% of their income.
Other questions? Oh, no. Sure. So the question was, can we run through the financing of this one more time? And I'm going to borrow Fred's notes from down here because that just makes it easier for me. So the financing is $1.7 million investment between United Neighborhood Community Centers and United Way together, which will relieve more than $239.6 million in medical debt. 112,018 people who are at or below 400% of the federal poverty line. Yeah, so oftentimes when medical debt hits collections, there is a greater willingness to accept payment of less than the full amount. And so when you're able to negotiate and buy at that level, you are able to sort of maximize the amount of forgiveness. Go ahead. So the question is, if debt goes to collections, are there are individuals just as individuals able to negotiate for lower prices? And I think that in many cases there are opportunities to seek some sort of different repayment term, but it is often a challenge because for many people who find themselves in these sort of circumstances, they often don't know about the debt or the sort of magnitude of it until they go to do something like get a car loan, get an apartment, and realize this thing has hit their credit report. And so that imposes some different sorts of administrative and psychological burdens on people and their ability to sort of navigate that process. Anybody who's had a medical bill to pay, even if it's a small one, can probably appreciate that it is not the easiest thing to do, even if you have a degree of familiarity with it. And so once a bill has crossed over from being in the hands of your provider to a debt collection agency and maybe sold subsequent to a different debt collection agency, even just tracking down who I need to make that payment to can be a real challenge. Sure. Yeah. So, so yeah, that's right. Yes. So I wanted to make sure I got that right. So the question was the breakdown of where the money came from. So, 1.2 million came from the anonymous donor. 500,000 came from, United Way through the Mackenzie Scott gift that we had received in 2021. Can't really share any details, but I will say that, this is someone who has some longstanding interests in partners across Marion County. Go ahead. Sure. The question was systems that are already beginning to make some of these changes and what they're doing. Dr. Huddleston, if you'd like to.
So I'll tell you what I learned is that they are, in some respects, working as a coalition, and in other respects, they're working individually, right? So I do know that IU Health, Eskenazi Health, Ascension, Community have all been linked up. I'm sure they're working with others as well to just ensure that they are helping to have policy at the in the State House changed, as well as looking at their own individual practices to try to get in line, which is why, for example, their federal poverty level thresholds are pretty well aligned because they've been working together. But individually, there are several systems that are doing things. So to the question about how do people deal with the debt, or how do you negotiate the debt, in one of my conversations with one of the systems, Eskenazi Health, they indicated that they do everything possible to try to work with patients who have debt and make them aware of discounts that they have. They try to identify those things, and they take multiple attempts before it goes as far as it goes into collections. I know that IU Health and others also around the transparency, price transparency, aside from the policy changes that have come from the state, individually and inside of their organizations, they're trying to make sure that they are more transparent from that perspective. So I think that they realize that it is truly a systemic problem, and so they're working as systems on this systemic problem collectively, but individually they are doing a lot of work. With that being said, the anonymous donors concerns and recommendations still raise an opportunity for the systems to work very closely together, continue to work closely together to make the type of transformation that I think we're all looking for and need. I would say that I'm encouraged by some of the actions that are already taken and some of the conversations that are being had about this issue. I think at the end of the day, putting Hoosiers first is what we are all are concerned about. But certainly, those who are underrepresented, underserved, deserve a fair shot. And so, I think that the conversations have yielded some results by some of the policy that we're already seeing. But I can't speak to what the next steps would be or what the true appetite is to address all of the requested changes. I'm going to turn that over to Fred Payne.
Sure. Undue medical debt will do everything that they can to make sure that the individuals receive the direct information. And the way that it really will work is individuals who they have received or they will receive a letter from undue medical debt identifying the debt that's been relieved. Then subsequent to that, they will receive a letter sharing with them other supportive resources from United Way and United Way service providers, so that one, it can help them remain out of debt. And two, it can help them on a path to financial freedom. So the image is that they're going to try to do everything that they can to make sure that they get the information into the hands of the person. So that means if they receive unreturned, mail, then they'll do whatever they can to make sure it goes to the person. But regardless, the debt is still relieved, even if they don't get the letter.
Yeah, so the question is, has the debt already been relieved, or are there purchases that still need to happen? My understanding is that it's the money transfers have already been made. So as far as the financial transaction is concerned, the debts have been relieved. I think it's to build on what Fred said. I think undue medical debt and all of us really who are involved in this effort are going to do everything we can, not only to support folks here with this initial announcement, but also make sure that people are aware on an ongoing basis that this is something that has happened, so that folks who may have moved, who may have changed addresses, as we often find to be the case, this will be something that is top of mind for people here, at least in the short term. Sure. So the question is this sort of programming happening elsewhere? And yes, there are several other large cities across the country where undue medical debt has worked with philanthropic partners to do similar kinds of activities. This is less about undue medical debt coming to us and us as a group going to undue medical debt and figuring out how we can leverage this investment into something really transformational for Central Indiana. Anything else? Yeah, so the question is, when do those first letters go out? My understanding is the initial letters have gone out. So they should be hitting mailboxes this week if they haven't already. And then there will be the subsequent communication with the connections to the community centers and other resources that are still to come. All right. Well, those of us up here will be around if folks have other questions, but we just really appreciate everyone's interest and everyone coming out this morning. Thank you very much. Good job. I'm too fat for this song.